Good Thursday morning. Good Thursday morning. This is Dr. Yonnette coming to you again with another episode of Baby Talk. Today, let's talk about parenting a child that is or who is over responsive to sensory input. Now, you may have a child that has, some sensory needs, and I want to address the particular child whose response to sensory input is like over exaggerated. A little bit of glue gets on his or her hand and she or he is falling apart. The world is ending. So what are some of the characteristics? What are some of the things that you would see in a child who is over responsive to sensory input? One, like I said just a minute ago, the child is going to have an exaggerated response to sensation. The child is also going to be very, very sensitive to stimulation from various systems. Remember, we talked about the various systems, the visual system, and we're going to go through those in a minute. You want to look for, or you will see that a child has an unusual and sometimes dramatic response to things like touch and noise and light and smell and movement. Okay, so today we are talking about parenting a child who is over responsive to sensory stimulation or sensory input. So what are some of the behaviors that you would see? The child gets anxious and fearful and is timid. The child is afraid to take chances. He or she can be very, very rigid and appear to be bossy and controlling. And then you can see some aggressive behaviors in this child. Or, he may become angry easily and avoid playing or participating in large groups. Additionally, you want to look for behaviors such as where the child avoids playing or participating in large groups, gets easily upset when there are changes in his or her routine, and they have difficulties with transition. Yesterday, I had a child that I saw that was just like that, this obsessive behavior. She's storming out of the room, it's time to change the activity, and the whole world is falling apart. She doesn't listen, she doesn't follow directions. She is having an over responsive response, if I could say that, to sensory input. Now, in terms of the visual system, this child visually, in terms of the visual system, this child, you may see that the child covers their ears or rubs the eyes or squints and complains about the light or the sunlight. I said ears. Let me take that back since I'm doing visual. From a visual perspective, the behaviors you will see in a child who is having an over-responsive response to sensory stimuli coming through visually, the child will cover their eyes and rub their eyes, complain about the light or the sunlight, may have limited social eye contact, and may have trouble sustaining eye gaze on the paper. Right? He or she's at school, they're working, the paper, whatever activity they're doing, they may have problems or trouble sustaining that eye gaze, and then they can have difficulty with tracking and scanning. So reading comes into play here, and so they should be, you should be particularly concerned about looking for these symptoms. Now, what does it look like? And let me pause to say that this information I'm sharing comes from information collected by an occupational therapist and Kuhn, who has written extensively on this topic. Now, how does this child appear to you? I said earlier the child may get upset when the hair is being very upset to sensory stimuli. So when the hair is being washed, the teeth is being brushed, you're combing and brushing the hair, or even cutting the hair and cutting the nails, there is such a traumatic experience that the child goes through. The child is also bothered by tags and seams on the clothing and different textures, and the child is very upset by sudden noises and unexpected touch. So you have to be careful. Be careful with this child. The child is also very careful with positional changes. And so, getting off the ground is a challenge for this child. And then you may also see the child gagging or vomiting at smells or even food when food is placed in the mouth. Here are some considerations that you should make when you're dealing with your child who is overly responsive to sensory stimuli. You want to avoid touching the child unexpectedly. Cue the child in, let the child know that you're going to touch them, be in front of him or her so he sees and the touch is not coming from behind that, really startles him. You want to give the child a heads up when a change is going to occur. Set a timer. Let the child know in 5 minutes we are going to transition to another activity so the child can prepare him or herself. You want to encourage and celebrate the child when he or she steps out of the box. The child never gets on the swing. You want to make a big fuss about it when he or she does that. And you also want to use aromatherapy, things like lavender and jasmine, and help validate the emotional responses that the child may have when he or she have a kind of abnormal or atypical response to sensory stimuli. And I am going to stop here for today. We are going to continue with the kind of responses that you would expect to have a child. You would expect to see a child who has an over-responsive response to sensory stimuli. Raising your children, raising a child is such an awesome responsibility, and an exciting responsibility as well, experience as well. So I encourage you to do all you can to raise a successful child. Get all the help you need. If your child is having some sensory issues, speak with your occupational therapist and get the help you need so that your child can have as normal as possible a life that is available to him or her. Keep journaling so that you have information to share. Keep taking care of yourself and take care of baby. Until we meet again tomorrow, have a fantastic day.